Thank you very much. So now, after hearing sort of the political dynamic around healthcare reform, we're going to hear more about the economic dynamic. Dr. Uwe Reinhardt is a professor of political economy at Princeton University. He also serves as an advisor for government committees and commissions and serves on the board of advisors of the National Institute of Healthcare Management. He has served on the board of trustees at the Duke University Healthcare System and the board of Triad Hospitals Incorporated. He has served as a commissioner of the Kaiser Commission of Medicaid and the Uninsured, and was appointed to the National Advisory Council for Healthcare Policy, Research, and Evaluation for the Agency for Healthcare Research and Quality in 1999. Dr. Reinhardt was elected to the Institute of Medicine of the National Academy of Sciences, and at the Institute he served on a number of study panels, including the Committee on the Implications of For-Profit Medicine, a panel on the nursing shortage, the Institute's Committee on Technical Innovation in Medicine, and the Committee on the Implications of a Physician Surplus. So all please welcome Dr. Uwe Reinhardt.
Well, good morning. As you heard, I was invited to speak here to make you all feel intellectual superior because, as Celinda said, economists are from Mars, which actually is sort of true. We invent in our teaching different societies where people are rational, well-informed, not emotional, and then they always do the right thing. And therefore, we make predictions that completely miss the mark. As, for example, Larry Summers, Clinton's economic advisor, said you don't have to regulate derivatives because people on Wall Street are well-informed and rational, and that market works, which qualifies you, of course, to teach in the Ivy League, where I teach as well. So you have to take everything I say with a grain of salt. Some people have said economists are people who know the price of everything and the value of nothing. It's actually not true, but that's what is being said. And it hurts more, but the worst I've had was a student posted on my door saying, an economist is like a man who can describe 1,000 ways to make love, but he doesn't know any women. And that hurt the most. It was interesting to listen to these speeches. I could give a speech just reacting to all these, what was said before me. Larry Gage talked back to the time of Ronald Reagan. Some of us remember those times. That was the time where, of course, we hugely increased defense spending. So government spending didn't really go down much at all. But there was, initially at least, a rather mean-spirited approach to social spending. You may recall, and some of the younger ones won't, that ketchup was declared a vegetable for defining school lunches. And it took the late Senator Heinz, a good friend of ours, I bet you too, who said, let me declare in public that Heinz ketchup is not a vegetable. But those were the days, and every so often we go into those. And what that means to me, I come from countries that have social solidarity, Germany and Canada, and that's where my soul was programmed. And I still feel like an outsider after so many years here. I still look at it from the outside in. I see in America, and have since I've come here basically, or certainly since Ronald Reagan, a huge ideological struggle over how to slice up this national pie called GDP. Where do you put the knife, and how big a slice should the poorest get, how big a slice the middle class, and how big a slice the upper income groups. And it turns out the knife has constantly been moved in favor of the upper income groups. And it's an incredible struggle back and forth. What is really remarkable that the Tea Party, I respect these people, by the way, they know something is wrong with America. I'm not sure they actually fully understand what it is, and they're actually the handmaiding of the people who would take benefits away from them, which is amazing. There I would say, try to take a benefit away from the French citizens, and you will see they will stand up for that. In America, the interesting thing is that the people on whom you put the squeeze either don't vote or vote for the people who squeeze them. And that's what you're really up against. Now, I don't know whether that is because Americans really don't understand what goes on, or whether they all think at some point they'll all be millionaires, so it's just a matter of waiting. We actually now have less social mobility in America than they have in Europe. That didn't used to be the case. And you hear every so often of somebody poor who invents some new IT thing and becomes a billionaire. But overall, on average, if you're born into a poor family, the chances that you will stay poor too is much higher here than in other countries. So that's the struggle we're really dealing with. So I will I was asked to talk a little bit about the economy. So I want to talk something a little macroeconomics so we all understand what are all these numbers people talk about. Apparently I just got an email from my wife. Ben Bernanke gave a pretty sober speech, and the market is tanking. And I always say, gee, now finally you realize, a lot of people realize that before this economy is not in good shape. Then the healthcare economy, and then a little bit about the safety net. Where the ET went, I don't know. When somebody, yeah, I think that there must be a virus, or some Chinese went into my computer, health reform. It's actually usually spelled with one E, isn't it? Yeah. Okay, the macro context. Now, it so happens, I live in New Jersey, close to arguably the greatest authority to come out of 20th century China, who has this ability to take a complex situation and put it in one sentence. I can't do this, it'd be 8 equations, but this philosopher can do this. And this, whoops, her picture does not appear, but it's actually my wife. It's a beautiful picture. I don't know what in translation doesn't appear. Maybe she wants to not be recognized here. But she's actually a beautiful Chinese lady. And for every occasion, she has a slogan. For instance, I was trying to help her make the bed. And I don't know if you ladies appreciate that. The man always pulls at the wrong end when you do this or tucks it in wrong. And she throws it down and said, "Ho zhe bang mang yu mang." And I said, "So, what does that mean?" She says, "It means monkey, busy, help, more busy." Meaning, every time you help me, I'm busier than before. I think on average, that's probably true. But nevertheless, anyhow, I wish you could see her, a very beautiful lady. And this is her summary of America, the economy. It means frog, the Chinese means frog at the bottom of the well sees only sunshine. And we have been living in this well for 30 years and never saw that there are clouds on the horizon. And that is, of course, the American way, to be optimistic, forward-looking. Oh, we always cope with every problem. There was Japan. We'll deal with China. I'm not so sure. Japan is a small country with a very rapidly aging population. China is a bigger one with a huge reservoir of low-cost labor, and there's all the rest of Asia. Very smart people come to our campuses, about a third Asian. They come over here. We teach them a lot of things. They go back and do wonderful things. So I think we're up against much more competition than you may think. I ran across a paper by Michael Spence, the Nobel laureate, Council of Foreign Relations, and I would recommend anyone who wants to know something about the American economy to read this paper. And what they do is they make a distinction between those sectors that produce stuff that's traded internationally, cars, drugs, MRI machines, stuff that's traded, and sectors that produce goods and services that are not traded, high school teaching, education, Higher education is actually traded. We export a lot in the US, but government services, healthcare is mainly home produced, not bought internationally. So they have the traded, non-traded sector. And so for the traded sector, on a net basis, in the last 20 years, that is the sector subject to foreign competition, created only 600,000 additional jobs net. Some created jobs, but others laid off people in droves, right? They created very high value added per employee. For example, Apple designed the iPad. And Apple gets to keep in the value chain. You design, then you test it out, and then you manufacture it, you package it, you ship it, and you retail it. That's called the value chain. And different people have different pieces of that value chain. The big value chain is designing, developing this thing, thinking of it. So Apple keeps most of the money of the value chain, but it keeps none of the jobs. All iPads are produced in China by a Taiwanese company, Fox something, whatever they're called. No jobs, hardly any jobs created with the iPad. So that, but a lot of GDP added because we get to keep most of the money initially. But the problem, the threat that I see out there is that the Asian countries are crawling up that value chain. There used to be a time when Dell designed a computer, everything, the way it looked, the shape, the insides of it, and then told Taiwan to manufacture and assemble these components and assemble it. Then Taiwan said, you know, we could design this thing. You just tell us what you want. And now Dell is basically a marketing organization that figures out what people want and then tell Taiwan, you design it, the shape of it, the innards of it, all the stuff, get it manufactured in mainland China and ship it to us. You see, they're crawling up the value chain, and that is what is hollowing out that sector of the economy. The non-traded sector created 27 million jobs on top of 121 million in 1990. That was mainly government. Government, the biggest job creator in America, healthcare, real estate construction, and retailing. Those are the big sectors. Those, however, per employee have low value added. And because government's fiscal problems, those sectors are not likely, I should have said, all of these sectors are not likely to grow as fast in the future. And that is what creates this problem with unemployment. The idea that somebody comes and says, you know what, I'm going to cut taxes and the unemployment problem will go away is pure, unadulterated, all-American bullshit. This is not, you're up against this. You're not going to do it with tax cuts. Nor can President Obama. Now, Bill Clinton has a big mugshot on Newsweek today, I think this week, on 10 steps to create jobs. The little suggestions he makes will create some jobs, but it's not a solution. We're actually facing chronic long-term unemployment, structural unemployment. Used to be 4.5%, 5% was considered the natural unemployment rate. That's probably going up to 7 or more to 8. And the real problem is we have no social policy in place for someone who loses their job at age 50 and never gets another job. You will treat them. You will treat them. So here is the same what I told you in graph, in case you didn't believe my English. With a graph, I'm sure you will believe. It looks scientific. I actually copied it right out of their stuff. So this was made by a Nobel laureate, not a little country economist from rural New Jersey. So, okay, so now this would have been bad enough if we had had a government. I mean, now you can say if we had a government, but at some point in the past, we actually had a government in Washington. If those governments had been fiscally prudent, had a good industrial policy, had to think what should be the structure of our economy. For example, Eric Schmidt, Google, on TV the other day, said, we need an industrial policy that helps to bring manufacturing back to America. So the iPad would be made here rather than in Asia. Unfortunately, we have a bunch of self-inflicted wounds. The first one is an undue obsession with real estate. That seems to be why Americans get born. Why are you born? Why did God create me? To own a house. That is not really the purpose of life. You can rent houses, and it's sometimes much smarter not to have these damn things. Rent them, then you don't lose half your equity. I personally consider Freddie Mac and Fannie Mae economic and political monstrosities. They should not exist. They should either become pure for-profit companies or be part of government and accountable for what they do. But to create some entity where politicians, when they're depreciated politically, can be parked and make $20 million and ruin a market, I don't think is a good idea. The sooner these get abolished, the better. But don't count on it, because it's a good source of campaign financing. The second one is a financial sector that owns the government. There's an article by the former chief economist of the IMF, Simon Johnson. Just Google Simon Johnson and governance, and you'll get the article in Atlantic where he says, if you actually really look at what happens to countries that get in trouble, some oligarchy always took over the government. And he said, in America, it was the financial sector. Goldman, where does Goldman end and U.S. government start? You tell me. You know, they go back and forth. I don't think President Obama doesn't do anything that he doesn't call Goldman. Is that okay? And that should not be. That shouldn't be. Therefore, it's insufficiently regulated because they own the government. They're not going to make sure they're not going to be regulated. Read today's USA Today, the money section on the side. Angela Merkel says we have to bail out Greece or German banks will get stiffed. And Americans wrote credit to insurance on those bonds, on the money that the Germans lent. You know, it's a whole chain. These guys own us, and they make sure they never suffer. The guy who ruined Lehman Brothers, went into the sunset with $400 million. That's what you get. The difference between wrecking a bank and making it flourish is $1 trillion versus $400 billion. That's the reward system. And then it's allowed to create periodic asset bubbles. Well, we've had one. Real estate, .com stocks, we're having another one. We're sailing. There will be another asset bubble. We just don't know what it is going to be. But everyone tells you there will be. We're not free from this disease. And you see what happened. This is the percent of the GDP in private investment. The bottom one is residential. The green is residential investment. That is not office towers. It's just houses, homes. And you can see in the last years under the Bush administration, a larger share of GNP was devoted just to home construction. Now, it's very nice to have a home, but it doesn't make you competitive vis-a-vis Asia. It really doesn't. What makes it competitive is have a machine that can produce stuff, not a house that's ever bigger or two houses, or houses so big that you need intercoms to communicate. Look at what happened to business investment. That is the red line. It actually went down. So when you say the tax cuts will make the economy grow and so on, it's just bullshine. What happened, we had two big tax cuts in the Bush administration. See what happened as a percent of GDP. Business investment actually went down. We built bigger houses, or two or three per family. The other self-inflicted wound is a mindless anti-government attitude. I was explaining earlier, we treat mothers and governments very badly in America. certainly teenagers, right? When teenagers really hate to be regulated by their mothers. I hate mom. When I'm 18, I'm never going to talk to her again. And then they go in trouble, and where do they run to? Right past dad, to mom, right? This is how, that's the purpose of mothers. And government's the same thing. You know, I hate government. Government can't walk and chew gum at the same time. Actually, Lyndon Johnson said something else, but I make it more elegant. But when you're in trouble, the bankers went on their jets, went to Washington, they said, we defecated all over our balance sheet. Please clean them up for us. Bankers. And then they go in their golf cart and curse government afterwards. Can you understand this immature behavior? I mean, at least teenagers grow out of that. Right? Corporate executives never grow out of that. They behave this way all the time. I think it's a terrible thing. I saw this. You can buy, I bought one of these. I wear it to annoy my students. I teach future civil servants, so I wore a shirt that says, I hate government, you know, basically, just to annoy them. But here, I love my country, but I fear my government. How insane can you be? This wasn't somehow sent by Darth Vader here. I thought we voted for this. I think it's part of us. But there it is, and it started with Ronald Reagan's famous speech, government is not the solution, but government is the problem. It should have said government isn't the solution to all our problems, but sometimes it really helps. That would have been an intelligent statement. This is not, right? And yet that gets worshipped. I actually found it very interesting. The Republicans worship Ronald Reagan. I think he was a very nice guy and did some good and so on. But I would not make him sort of the beacon of America. I would pick Eisenhower, who warned us, among others, of the military-industrial complex, which I think is to give a huge industry a stake in war is not a great idea, by the way. But when Eisenhower warned us, what I can't rephrase it, Larry, what you quoted him. Oh, well, mortgaging, yeah, that's what it was. That's exactly what we have done. So we have overcrowded, crumbling public infrastructure, which is getting worse and worse and worse. Anyone who flies, overcrowded airport, Amtrak, you know, the Chinese only laugh that it takes 6 hours to go from Boston to Washington. They do that in 2 hours in China, 2 hours with a bullet train. We, of course, have an idle construction industry, but we cannot redeploy them into public infrastructure. Why? Because that's government spending, which is bad. So therefore, we sit on lousy, shitty trains because government is bad. Explain that to me. This is a Chinese train. Have you ever seen anything like that in the US? You got to go to Beijing or Shanghai to see this. I look at it, they think a cellar is something. A cellar is a joke to these people. And the train sailors. Have you ever taken that train from New York to, that's where American sailors are trained, because the theory is anyone who can walk that train can walk on a rolling ship. It really is, it's the most insane thing. And then I was wondering, what do the Chinese think when they come here? The fourth wound is this fiscal mismanagement. You remember Louis XIV? Some of us are old enough to remember him. The Sun King, and he said, "Après moi, le déluge." After me, the flood. That's how he lived. And that has become the motto for our politicians. And you see it right here. We still have people who want to cut taxes. Can they really be serious when they look at this graph? You see the top line here is government spending as a percent of GDP. And the bottom line is government revenue as a percent of GDP. And we've been on a debt cruise ever since, with one exception, when we had a government. And you see, with Reagan, they say the tax cut created this great economic miracle. The tax cut trebled the deficit from 1 trillion to 3 trillion when he was, and the public debt. Deficit throughout the Reagan years. And then President Clinton and Bob Rubin, to their credit, That's the one good thing they did. They also did bad stuff. But the good thing they did is they created a surplus. And I have to say, in fairness, the Republican Congress, led by Newt Gingrich, helped. Then we had a bipartisan government that actually could get something done together, and in particular, balance this budget. And we had a surplus. Then came the Bush year. Then came the big, of course, recession. President Bush's last budget had a 1.3 trillion deficit. But the problem is, we in the future, we expect continuously to borrow. And Doug Elmendorf said the United States faces a fundamental problem. We want more from government than we're willing to tax ourselves to help government pay for it. This is immature. This is childish. So when you say you sometimes don't understand how people, they have cognitive dissonance is the term, two different theories in conflict. Americans suffer from this mental disease, cognitive difference, that you somehow can get all these benefits from government, but you don't have to pay for them. You know, we learned from the classical Greeks a lot of stuff, and now we learn from the modern Greeks how to run a government. We are among the least taxed nation in the OECD. Every other country pays more taxes as a percent of GDP than we do. So when you hear politicians say we're an overtaxed nation, bullshine. That actually should have been a good title for my talk. Bullshine. This is total nonsense. We are the least taxed nation on earth. So it's a self-inflicted wound. Now, our savings do not cover what we spend on investment for replacing capital, new capital, and the deficit. Here is the personal savings rate as a percent of GDP. That's what households save. Till 2005, that went down and down and down. We said, hey, we're going to live up. You know, the only way that Americans could be called rational in their approach to life would be that they know World War III is around the corner and we'll all get wiped out. Then being in debt was a good idea, right? Because, hey, the last thought you have, I'm going to stiff my creditors. Boom, you're dead. This is business savings, and that's the total. So there wasn't enough. So we had to borrow from China, Japan, and other countries. And this is what we borrowed. These are the dollar amounts. Look, some years, 800 billion a year, 6% of GDP. Our GDP was 6% short of what we wanted to spend, so we borrowed it from China, a communist country, a poor country at that. And the only reason it's down because we import less at the moment. And here's Mao Zedong say, hey, they hooked us on opium, we'll hook them on credit. And what that means is we lost control of our foreign policy. Do you ever think about it? If we wanted to do something China doesn't like, they say, we're not going to buy bonds next month. How do you like that, my friends? The stock market would collapse, and therefore our president would say, excuse me, I'm sorry I thought of it. And that's it. So we lost more than markets. We lost control of foreign policy, I think. So why is this relevant to healthcare? Well, government pays for half of the healthcare in America, and we don't want to pay taxes. This is Medicare, Medicaid, other public, including public hospitals, private insurance, out-of-pocket, and other private. And that goes to 2019. But what you will see, and that's supposed to be 20% of GDP by latest numbers, that much is government, that much is private. It's half and half. And we are not willing to pay for that bottom half. And that bottom half may get cut. I actually don't think it will. I think eventually governors and local people will realize you just can't do this because they don't want to step over people in the street. It's really that. So I think actually the cutting, the Medicaid, I don't think it'll actually happen. But you never know. Why is government so big? Because government pays for the most expensive people. This is the number of people in private insurance, and that's the share of the healthcare bill paid by private insurance. And the government is half and half. Government takes care of the sick, the poor, and the disabled and the old. Everyone the private market doesn't want to deal with, government pays, and you deal with. So the problem, though, is during the last 40 years, health spending overall has grown 2 percentage points faster than GDP. That's why percent of GDP is going up all the time. If that trend continues, we'll spend 40% of GDP on healthcare in 2050. Now, students ask, could that ever happen? I said, why not? That could happen. I mean, the world will look different. There'll be king-size beds from coast to coast, made in China, each bed. In each bed, 2 Americans with MD degrees giving each other checkups around the clock. They would send each other bills, and some computer geek in India would add up these bills, and that's 40% of GDP. So, yeah, this could be nice if you thought about it. But I'm not sure we'll do that, actually. I'm on a body that advises the actuary of CMS to make that 75-year forecast, and we are sort of thinking of GDP plus 1 and GDP plus 0.5% for the next 50 years. So somehow this sector has to come down. We just don't know how. But here is an interesting number. There's a thing called the minimum Medicare index. For some database of 10 million commercially insured, employment-based insurance, they add up the employer's contribution to insurance, the employee's contribution, plus out-of-pocket. They have data on out-of-pocket. When you add that all up, in 2011, on average, for a younger, below 65, American family of 4, it costs $19,000 for health care. That's the actuarial average over sick and healthy. Now imagine if you make $35,000, or if you're a waitress, you make $25,000, and somebody says, oh, you should be responsible for your own health care. How would she eat? Right? I mean, these are the real problems. Look at this. It's a growth rate of 8.8% per year between here, more than doubled in this decade. In recent years, 7 to 8%, but still far ahead. Now, we believe that all of this comes out of, let me click this out. And what you see here is that actually employers never pay a damn thing for your health care. When an employer gives you health care, basically they take it out of your take-home pay. It's like being at a garden party, somebody steals your wallet and buys you flowers, a pickpocket, and you say thank you. That's what employee benefit managers do. They are pickpockets who take your money out of your paycheck and they give you a health insurance premiums, That's what they are. They're nice people, though. They're basically social workers dressed up to look like business people. But that's what they do. Now, if that's the case, if you have low-wage workers, more and more low-wage companies will ultimately just dump their employees into the exchanges or leave them uninsured. So I actually believe that they'll end up either way in the exchange or be uninsured or be in Medicaid. And I expect the number of uninsured to grow. Let me tell you, mark it down in your book just to see if I was right. 10 years from now, we'll have at least 35 million uninsured, at least 35 million uninsured, not 25. That's dreaming, because this trend isn't programmed into the CBO numbers, that there'll be more and more and more dumping out of employment-based insurance. So anyhow, what about the safety net? The insurance. What it tried to do was actually quite reasonable, and even Republicans would completely agree with all of this. That's the irony of it all. Why? Because the Obama plan was essentially a Republican plan. That's what it was. If you want to see what a Republican plan looks like, there was one passed in 1993, developed by Senator Chafee, the late Senator. Reinhardt subscribed to it. And Kaiser, in its website, does a side-by-side comparison with that Republican plan and the ACA. It had a mandate in it, all of that. Obama passed a Republican plan. So therefore, all of these things, reform, covering insured, reforming the small group market, before Obama came on the speed, Republicans would have completely endorsed what I'm clicking out here. Integrated care, they wanted. Mark McClellan started the talk about ACOs, greater transparency and accountability. They wanted to move to bundled payments and control health spending. This is a completely bipartisan agenda for America. That's the irony. And most of the bill did cover all of this. That's why it's so long. Now, did it reduce healthcare spending? No. The February forecast, February 2010 is the red line, and in September, after the bill was passed, the blue line. So on average, every year, the Affordable Health Care Act will increase total government spending. It did not control healthcare cost. So the top line has health reform in it. That doesn't even include the doc fix, by the way. Now, here's a bridge, and if you look very closely, on top of that bridge is the executives of American public hospitals. After this bill passed, you can't see them, but they thought the end is near. There'll be no more uninsured. We will lose all clientele. There'll be no more dish money. We're finished, kaput. Bullshine. You will be needed ever more than before, I think. This is what the CBO says would happen to the uninsured under the bill. We'd have only 23 million uninsured, mainly undocumented immigrants, and so on. I don't think this will happen. You can raise those blue bars at least halfway up. Why? They're not going to go and subsidize to 400% of poverty line. They'll go down to 300, maybe 250 to balance this budget. So a lot of people won't get subsidies, and a lot of middle-class people will be uninsured, and you ought to attract them, uninsured middle-class people, to say, we can help you on reasonable terms, good care. You ought to go after that, because they will be there. I'm telling you, there's not going to be only 23 million uninsured in those years. The challenges you face, I think I don't need to, I'm just listing them here. The potential loss of dish money. After 2000, something like 20 billion a year is supposed to be cut. I don't think that'll happen because the governors will realize, and Medicaid, that they can't afford to let these hospitals go down. Potential loss of commercially insured patients to private facilities. I'm not sure. People got used to you. I'm not totally sure how quickly they switch. People generally, you saw Celinda's slide, people go to the hospital that they always went to. That has a lot of drawing power. Probably a change in mix of patients. You have a larger fraction, possibly, of undocumented immigrants. Potential loss of support from state and local government and private donors, particularly if they don't like undocumented immigrants. Then they would say, hey, that's the place where they go. If we kill that beast, they won't come to America, which is, again, not going to happen. But private donors, I don't know how important they actually are in the sweep of things. Or people may assume that the ACA solved the problem, so why should I write a check? I thought we had health reform to take care of that. So those are threats. What I think everyone, and I've heard you say it and read about it, you have to understand your cost better than ever before for every damn thing that you do. And you can now use software that can track every order entry of every doctor for every patient by every input. That software exists. I bet your UHC has it. Premier has it. I know private entrepreneurs who have that software. Once you have that, you can construct profiles by doctors, and you would be surprised how much variance there is in the cost doctors incur to treat a cholecystectomy or a cabbage. And you can then do management accounting and managing the way any business enterprise does if you don't already do that. Reject being a source of patronage. Now I know that must be very difficult because the very people whose idiot nephew you got to hire will be the people who preside over your budget, right? So you hire the idiot nephew. However, you can always leak stuff like that to the newspapers and claim, hey, I didn't do this, just to get some attention to the patronage. Because I do believe charity had a little bit of that, didn't it, in New Orleans? If need, we upgrade the physical appearance of your facility. I served on a for-profit hospital board. Maybe you will hate me now, but I was quite comfortable doing that. We gave a lot of uncompensated care, by the way. We bought Quorum Health, and with it a public or a general hospital that they owned, but it was really run down in the inner city, pretty much run down. And initially, the board says, well, we will divest this hospital. But then our CEO looked at it and said, you know, with maybe 20 million, I can actually do a lot to make this hospital really look spiffy, get some better equipment now. That was obviously we had access to capital. And it was survived, treats the poor, but also attracts the middle class. That's what we did. Sometimes these things are not so expensive. I mean, we did a lot to that hospital, but even just having the entry hall look nice with clean chairs, that was this CEO said, whenever a chair has a spot on it, I actually take it out and put a new, I have a room full of excess chairs, make sure there is never a chair that looks dirty in this place, in the appearance. I go to a lot of hospitals where that's not true. And that's very cheap to do these things. Explore whether you could become the core part of an ACO. Now, I don't know what an ACO is. Mark Smith of the California Health Foundation says it's a unicorn. It's a fantastic animal that can do wonderful things, but no one's ever seen one. My definition of an ACO is it's an organization that comes as close to Kaiser as possible without anyone realizing it. Because Kaiser is a German name, Germans are socialists, so you can't have that. But basically, we're really talking about Kaiser and this amorphous thing. I don't know if this will work, but you should try it at least, because it may work, and if you miss the boat, that wouldn't be good for you. And you could be the core of that, or you could become part of it, and explore if worst came to worst. We do, or we did at the for-profit hospital I served on this board I served, joint ventures with nonprofit, religious hospitals even, where we put in 80% of the capital, but the board was 50-50, right? And the community never realized. We just supplied the capital and asked for a return on it, that's all. And we supplied management, computer systems, whatever they wanted. But the community never realized that actually in it was some private money. So put away the sackcloth and ashes. I think you are personally less threatened than I was talking with Ron last night, and you think that as well. You're not going to be extinct at all. As I said, there'll be, I think, at least 35 million. Washington governors and politicians will realize they cannot make it without you. In fact, I have quite the opposite theory. It could be that the only way we get to GDP plus 1% is to decouple publicly financed patients from private. And the world I think of would be that publicly financed will be treated in public hospitals, public clinics, everything public, where you can give them budgets and you can ration health care as a politician without having to tell God that you did. But nevertheless, that is what you could do. So I think your tier in 2030, you may be double the tier than you are now. It could very well happen. The uninsured, low-income patients, especially those on Medicaid, may find it very difficult to actually get access. You know, they have an insurance card, but they can't get a physician. And there was a paper just last week in the New England Journal of Medicine, I recommend it to you, auditing access to specialty care for children with public insurance. And this says clinic scheduling specialty care appointments for children. For privately insured, it's the dark bar. For Medicaid, it's the light bar. In other words, these are clinics, and if you say, I'm on Medicaid, they say, our book is full, we can't take you. And they will come to you, because they'll come to your emergency room, and that's where they will get treated, because the private sector may not treat people on Medicaid, particularly if reimbursement goes down. Wait time for an appointment in the public, you could see 40 to 75 days, 103 days. In the private, far lower, 1/3. So there is actually, in my view, an opportunity there for you to serve where the private system, they have insurance, but to have an insurance card doesn't necessarily mean you have physical access to particularly physicians. So I think in these sorry data, there actually lies a competitive advantage for you. You can actually focus on people who are insured, but who are not being served by the private sector, and you will. So carpe diem means seize the day, do that. And I think 5 years from now, the meeting will be bigger. I think you'll be around, and you know, if you're on that bridge, enjoy the view, don't jump. Thank you very much.
Thanks very much, Dr. Reinhardt. I think given the time constraints, we're going to probably skip the Q&A, and we'll be going into just a networking about half an hour before we go into our breakout sessions. But before we conclude, I wanted to welcome a friendly spy who is in the room with us. John O'Brien from CMS. John, give us a wave. John is the field director for the Partnership for Patients, a program that I think all of you have probably heard about. Very much appreciates being here and learning about what we're doing at NAPH and what you're doing in all of your local communities. He's going to be here all day. I think he's going to be sort of outside most of the time meeting people near the Internet Cafe area, and he'll have a place for you to sign up for the Partnership for Patients and the Partnership Pledge, and learn about other ways that we can work together with our friends at CMS. So seek out John, he'll be around. And I think with that, we will conclude this session. We're going to be doing our networking break until 11 o'clock, so we have about 25 minutes, and then we'll be going into our 3 breakout sessions, which will start promptly at 11, and you can see what those 3 breakouts are in your schedule. Thank you all very much.